Welcome, welcome everyone. Welcome to IFMA Toronto and South Central Ontario September web series. My name is Sarah Claire. Oops, I think I just got muted there, but by day I proudly work for Infrastructure Ontario. I am your virtual moderator today. Thank you for tuning in. We welcome all of our members and non-members, or as I like to always say, future members. Today's presentation is being recorded and will be posted to the IFMA YouTube channel afterwards. Thank you to the IFMA team for making this presentation possible. That's especially to Kay Pace, Maria Stenberg, and Sean Bates. Whether you are a facility manager, end user, or a landlord, you are tuned into the ever-evolving response to the pandemic and impact on the workplace. We are so excited to partner with David Levy and the Facility Plus team on cleaning, disinfecting, and decontamination in the workplace. Today, David will guide us through Facility Plus's strategy as a trusted service provider and how they have and continue to navigate the decontamination of workspaces, both proactively and in many cases, reactively. Today's presentation is approximately 35 minutes long, leaving lots of room for active discussion afterwards. And I hope you're paying attention because when we open up our Q&A, we have some fantastic prizes to give away courtesy of the Facility Plus team. Before I conduct our speaker introduction, I'd like to pause for a safety moment. Everyone plays a part in stopping the spread of COVID-19. It is hard to believe that we have been in lockdown for 6 months. As a beautiful summer winds down and we step into the fall, many feel plagued with the coronavirus burnout and pandemic fatigue that we're hearing about in the news. Unfortunately, the spread is still going strong in many areas and we really need to be diligent in our efforts. You can do this by making a commitment and continuing to keep yourselves and others safe, by staying flexible as recommendations change from government public health outlets, continuing to practice precautions until they are second nature, if they aren't already, and keeping necessary supplies handy, and of course, encouraging the entire family to stay consistent. We are very excited to announce that we are resuming our educational opportunities through IFMA virtually. We have a very special promotion on right now that closes end of day tomorrow. Friday, September the 25th, where we are offering $250 off of the FMP. That's the Facility Management Professional designation. This course is relevant for all facility management professionals and industry suppliers and will increase your knowledge in core FM topics deemed as increasingly critical by employers. This is for an October 1 start and is a 20-week duration. This will be delivered virtually every Thursday at 6 p.m. to 9 p.m. Again, this closes end of day tomorrow, so please reach out to us if you are interested in elevating your career with us. Now I'm going to introduce our speaker. With over 33 years of industry-leading experience, David Levy is the proud founder and president of Facility Plus. Since 1987, David and his team have been delivering the highest quality of facility services to many sectors, such as commercial, industrial, retail, and retirement homes. David has gained extensive experience during the COVID-19 pandemic by leading cleaning and disinfecting services and emergency decontaminations at hundreds of essential customer locations across Canada. David's contributions to many industry-leading associations, most importantly IFMA, and his involvement with several local charity groups continues to be recognized. David was awarded the prestigious 2019 IFMA Chapter Sponsor of the Year at our silent auction last November. Facility Plus and IFMA are proud partners, and again, we cannot thank you again for your support, David. And with that, I will hand over the presentation to you, David.
Thank you very much. Happy Thursday to all IFMA membership and all guests and hopefully soon to be IFMA members, like Sarah was saying. I'm very excited today to be sharing what my teams and I have learned over the past 6 months during this pandemic and what we've learned across Canada. So we're going to start off by, we were fortunate enough to be chosen from Tim Hortons. They came in and they're kind of awarding frontline workers and frontline essential businesses and helping other essential businesses stay open. So we're just going to show this brief 30-second video just to give a shout out to all of our teams across Canada that have been doing a great job of keeping essential businesses open, keeping ourselves safe, and keeping all the customers and their visitors safe as well. So here's the video. Sure. Is there? I would. I'm hoping there was some sound there.
Maria, can you unmute us for a moment?
We can just, it's only 30 seconds. We maybe
Yeah, no
just,
problem. We
okay,
definitely want to get
sorry
through
about
this.
that.
No
Yeah,
problem.
the video does have sound. Let's just give it a second. Sorry, folks. Might be on your end.
Maria's just double checking that we can unmute everybody.
Yes.
And we'll make sure to go back to this because we do want to share this awesome video.
Thank you. Sorry about that.
Okay, so we're not muted. I'm not sure what the issue is here, but maybe we can come back to that and troubleshoot in the background. Just don't want to disrupt the flow too much.
Perfect. Exactly. So we'll move on to our next slide. So our next slide is what we found very important, obviously, during this pandemic and the last SARS pandemic, well, kind of the last SARS threat back in 2003. We learned a lot of valuable lessons from 2003 of making sure that we were prepared with lots of PPE, lots of different products, lots of different supplies. Now, funny enough, back in SARS, we all kind of got very lucky. That only lasted for 6 months. There was a second wave. We ended up having lots of product expire, and we ended up having to move on from that product. But in hindsight, that wasn't a bad thing. Considering today's pandemic, we've had lots of difficulty sourcing PPE during this COVID. And the lessons we have learned is trying to find sustainable suppliers across Canada. With Canada being such a small marketplace, it was very hard to build our inventory up. So we had to start going worldwide, and then we started to become very relentless and to find good partners. It was amazing how many companies kind of retooled their businesses. Companies like Bauer started making masks in Canada. Other companies started to retool to make hand sanitizer. Other companies were doing their best to do all sorts of different things to help out the Canadian marketplace, because as we knew, it was very hard to get things across the border. It was very hard to get things from Asia to Canada, because we learned some very good lessons about that. You can also see in PPE, not all PPE is made the same. I can just kind of share with you real quick. You know, there's different kinds of face masks, face shields, and some of them are not the best quality. So we learned some very tough lessons where we put a very large order in for different kinds of face shields. And unfortunately, when they arrived, they weren't kind of as advertised. So we've learned no more buying in bulk. We say send us a sample first before we start buying anything large. We got to be careful with that, because what we tend to want to use is much better quality face shields. Something like this that has some straps on the back, straps on the top, can go over top of your head. And it's a much stronger face shield on there. You can see our mannequins here have kind of all the best equipment that we like to share with our technicians across Canada. And then when it comes to masks are not all made the same. As we know, there's all sorts of different kinds of masks for these medical masks, surgical masks. The one we've landed on is a level 3 mask, and it's the best quality we have, because level 1 is truly level 1, even level 2. You want something that's good quality when the mask here. So we've been able to find suppliers now. We find when the containers come in, they land a lot in Vancouver. So we have great partnerships now in Vancouver, where we're getting a lot of our supplies of our masks from there. There's also many different types of N95s on the market. This is kind of the newest N95 mask that's on the market now. It has this here. I will caution you, whenever you see a mask that has this little filter on the outside of it, you need to have some kind of filter put on the inside, because when you're blowing through this and breathing through this, is not stopping, let's say, hopefully I'm not, but asymptomatic, or I may be sick, or I may have COVID, it's going to be coming out this little vent. So what we've done is we found these little N95 filters by accident, because some of our other masks that we have were running out, and we had to come up with a game plan to replace our other filters. So this mat, what we've done is we take this little filter.
It looks like it's lopsided.
Sorry. And then what we do, we take these little filters and we put them inside these masks.
Yeah,
Now you're good. Now you're good to wear this mask.
Yeah,
Anytime you want. And the good thing about this little N95 filter is you can wash this with warm water and soap. We try putting them in the washing machine. We don't suggest that, but these little filters you can wash and you can make them, you can reuse them and just let them air dry. What we've also done with these little filters is we've been able to put them, what we do is we sew two together, and we put them like, we sew two together and then put them like this. And then what I'll do is I'll put them in my favorite hockey team's mask, and they just go over like that, and I'm nice and covered. Then I know I have N95 protection inside my mask, so I'm not going to affect anybody and nobody's going to affect me. So these little things here have come in handy. They're a great idea. With the KN95 mask. It's a good little mask, but again, just to improve it even more, we can put these little filters inside.
Pass, is it bad?
We make the mask even better. So this is a great idea.
A little bit.
Share with you also some of the things we've learned about.
If it's pissing me off, I don't come back to
We
it.
had
Sorry to
one-
interrupt you, David, but everyone, we seem to be having a challenge with our mute function. If you are not one of the hosts, can you please ensure you are muted because we can hear your conversations. Thank you so much. Sorry, David, back to you.
Okay, sorry, thank you. Okay, so we will give you some hard lessons we learned. We did have one of our hand sanitizers recalled. So we had a customer, we had a supplier that we've had a relationship for 25 years. I'll just give an example. Like right now, because we've asked for so many sanitizer, you can see this bottle came in, they sent it into us from Louisville, Kentucky. So we have like a samples room, and every day we're getting samples because we will not order anything anymore unless we get a sample first. And then this one came into us and said, here's a hand sanitizer. I'm scared to see what kind of alcohol level this thing has in it. But the one that we had a hand sanitizer from a very reputable company that we've done business with for many, many years. They brought it over to us. Luckily, we only sold it to 3 customers. The 3 customers received the product. And then we got a notice from our supplier. They called and said, what we just sold you is being recalled by Health Canada. I think it would have been better to be audited by the government than have Health Canada chasing you around. So what we had to do is we had to get all the product back. We had to notify all of our customers about the fact that that product was recalled. There's only 3 of them. We got very lucky. The good thing about the product that was recalled, it was a color blue. So most hand sanitizer is this clear color, as we know, but this hand sanitizer was blue, so it was very easy to tell our customers, the ones that we sold other hand sanitizer to, that one, yours is fine, but the blue one has to come back. We had to show lots of documentation going back and forth between the government, documentation between our customers. We had to dispose of it properly. And Health Canada had a laundry list of checklists we had to go through to make sure that we did a good job on doing what we had to do. Also, I would like to share with you about these little portable thermometers, these infrared ones. Really, I think everybody should have one of these in their home or car or at office, so you can kind of just see real quick how that person is doing, just so you can check it out. We believe in these that's part of PPE, that's part of your PPE kit. You want to have that as well. And also, just as far as some little gadgets, this little thing here, what it does is you can actually go on your wrist and you can spin it around, it's a little watch, and you can squirt out hand sanitizer. So it's a little pouch of hand sanitizer that we find that we really like these, especially if you're on a job, you don't have access to water. It's good to have something like that there. And also, just quickly, I'm a big fan of using these kind of little gadgets here for opening doors. This one here has a little stylus on it, so you can punch codes in at the bank, or if you're going in somewhere, you got to punch in your PIN. This is a little key to have as well that I usually just have attached to my keychain here. So we can go on and we'll look at, from there, we'll look at COVID-19, the management plan from there. So can we, yeah. So I think we talked about that. So as far as the importance of having a management plan, I think it's so important to have all the parties' information in your facility, have a plan in place, make sure that you understand how many people, if you do have a possible case of COVID or a confirmed case of COVID, it is really a domino effect. You have to have a company health and safety plan in place, you need a COVID plan in place, you need to be able to alert all the employees, the landlord, the property manager, all family members, all visitors, suppliers, be educated on all the provincial and federal regulations, have a third-party environmental company come by your office to help you with a COVID plan. We actually hired 2 companies. We hired Pinchin and we hired Rockmire Engineering. And what they did is they came in and spent time with us, and we put together a whole plan and saying exactly what needs to be done if we do get a confirmed case, a possible case, and they put together a whole package for us to show exactly what the steps to be taken. If it's just regular cleaning and preventive maintenance for cleaning, how you should set it up if it's a possible case, what you should do if it's a confirmed case. So we've had those companies come in. It puts me at ease too, because I know exactly when I'm doing something at one of my customers, I know, hey, well, these are the best practices as well, just in case a customer does not have some best practices in place. It's very stressful when you walk into a customer and they have a confirmed case and kind of look like this poor lady in the slide there. Like it adds a lot of stress. So it's better to be in front of it. It's also good to have a qualified contractor in place as well, and have that qualified contractor do a walkthrough through your facility prior to this whole pandemic, and you should be set up just in case something does happen. So we cannot stress enough. Please have a pandemic in place with your whole team. And most people are working from home, but for the essential businesses and the businesses that are starting to open up, and maybe we'll see what happens with phase 2, but you want to be ready with a pandemic plan. So the next slide is sourcing a qualified service provider. So the number one thing is you want to make sure they have proper insurance. So companies like ours, as soon as the COVID started to increase and grow some legs, first thing we did is we called our insurance carrier and say, are we covered for doing COVID decontaminations, possible cases? And they said, in our case, we carry, it's called pollution environmental insurance. So we carry $5 million worth of that kind of insurance. And what they said, well, since you're already doing sewer backups, you're already doing mold removal, you're already doing crime and trauma scene cleanups, you're already covered because it's already part of your day-to-day basis. Now, when you're looking for someone else to do the work for you, another contractor, you want to make sure they have access to the proper PPE. And do they know how to use it? Because there's so many different masks when you get into different kinds of, when you're doing a regular cleaning and maintenance, you can just use an N95 mask or a KN95 mask, or you can use one of these surgical masks. I also suggest when you're just doing cleaning and maintenance, that the preventive maintenance side, you have a shield on. You make sure you have some gloves. We prefer to use the gloves that are, they don't rip, because there are different ones on the market. These ones don't rip. They're good quality and they last throughout the day. You want to make sure that the company coming in, their technicians have been fit tested. So fit tested means when they come by, a company like Safety Express will come by your office or the location, and they'll put the mask on the person and say, let's make sure this mask fits you properly and it fits the way it should fit. Another thing you want to make sure is anybody who's wearing this kind of mask, in order to be fit tested and to carry a card like this, they need to be clean shaven. So whenever we do fit testing here, we have bottles of shaving cream and shavers, so we know you better come into work, you better be clean shaven, and when you go on the job site, you better be clean shaven, because the hair follicle will upset the seal around the fit test. And just on a side note, on these kind of respirators here, this has an exhalation valve or an exhaust valve. So again, what we've done is we've installed these little N95 filters, so we're not breathing out onto people with these type of masks. So these masks comes in all different shapes and sizes. So there's also what is called a full face respirator. I would recommend a full face respirator when you're doing a possible or confirmed case. You want to be using this kind of mask here. And then if you're doing again, this is kind of my favorite mask. This one comes with its own little air. So this one I can wear for about 4 hours, and it's got fresh air pumped into me all the time. It's much more comfortable because trust me, when you're working in a full Tyvek suit and you've got booties on and you're duct tape at the ankles and you're duct tape at the wrists, it gets very, very hot. So you want to make sure that you have that. You want to make sure that they're wearing booties when they come into your facility, little booties, and also that they're having Tyvek suits. So a Tyvek suit is a very good idea for them to have as well. So that's one way, making sure the contractor is paying attention and wearing the right equipment. Then you want to make sure that they understand about water damages. They understand about sewer backups. They understand about mold removal. What experience have you had in that? Have you had any experience in crime and trauma scene cleanup? What certifications do they have? Do they have IICRC? Have they done anything from IISA? Something you want to look for is it's called WRT by IICRC, which is Water Restoration Technician. Or do they have AMRT, which is Applied Microbial Remediation Technician? Or are they certified by MDCON? That's the crime and trauma scene. We have a lady on our team, Melissa. She used to work in the funeral home, so she kind of likes the crime and trauma scene business. So we wish her all the best on that. What practices do they follow? Like we follow ECO, we follow pension, we'll follow what Rockmar says to us. So we'll take their scope of work. What kind of documentation are they going to give you? Are they going to be giving you before, during, and after pictures? Do they use something like an ATP meter like this here? And what this does is you can swab, you swab a surface before, during, and after. You put it inside the ATP meter, and within 10 seconds, they can tell us how good a job are we doing? Are we knocking it down? Are we making a difference? Because in this machine right here, what we've done is we've already preset it for all the different levels of what the cleanliness should be on a desk, what the cleanliness should be on a telephone, the cleanliness should be on a doorknob, or they should be on a counter. So you want to make sure that what kind of verification are they going to be showing that they're doing a good job? And do they have an association with an environmental company that can come in and just verify their work, or your environmental company? Can they work with them and follow their scope of work properly? So that's some of the things to think about when it comes to hiring the right contractor. The next one will be pre-planning. So when you're pre-planning for a COVID, you want to make sure you understand the 3 levels of cleaning and disinfecting and decontamination. The first level is straightforward. It's regular cleaning and disinfecting. And in order for any disinfectant to work properly, you need to do cleaning first. A lot of these offices that have been sitting dormant for the last few months, I'm sure before they open up, they're going to do a thorough cleaning and disinfecting before they open up their businesses. But you need to remove that layer of dust, because the disinfectant it's not there to cut through dust. It's not there to be a degreaser. So you need to do a good thorough cleaning and disinfecting. If you're doing a level 2, which is a possible case, some people are calling it an enhanced cleaning or a level 2 cleaning. We treat a level 2 just the same way we treat a confirmed case, because we do not want to be sending our technicians into harm's way where the person is waiting for their test to come back. You can see now that the government has opened more test sites, which is just awesome, because the testing was 8 hours and taking some time to get your results back. So now they've opened up 60 more testing stations as of Friday. So that's awesome. So you want to make sure that when you're doing this type of decontamination for level 2, are they going to be full PPE? Full PPE's got to be worn. You want to clean and disinfect the high touch areas. You want to make sure the customer knows exactly what's going on. When you get into the level 3 cases, are they going to be building containment areas for you? Are they going to be cleaning 7 feet down? Do they understand the HVAC? Do they understand all the moving parts? So you want to make sure that you also know exactly all the interested parties that are involved. You got to be communicating as much as possible to all the interested parties, because nobody wants to be kept in the dark when it comes to COVID-19. We've seen it a few times where we've seen some companies have decided to try and keep it hush-hush with what's happening in their facility, and they've had confirmed cases. One of the employees complains to the labor board. The labor board's called in. Then we're called in now to clean up after that decontamination, because there is a confirmed case. And on a side note, the labor board I was reading yesterday has hired a whole bunch of other inspectors now, Ministry of Labor, just to make sure companies are following the proper safe distancing, the cleaning and disinfection, and when they do have a decontamination or they have a outbreak in their facility. So you want to make sure of that. You also want to make sure that some of our customers are gracious enough to let us look at their camera footage, especially in large distribution facilities, food facilities. We'll be able to see where that lady or man has gone throughout the facility, and then we'll be able to track them and say, okay, we know they went down this hallway, they went down there. We take the floor plan and we highlight, so it makes it a lot easier when we go in to do the work. And then we can also see if there was any cross-contamination as well with the people that came into that same work area as a person who has had a confirmed case. So what we usually do is we do an inventory of all the high touch areas. So we'll take the floor plan, we'll look at the washrooms, how many taps, how many sinks, how many knobs, how many toilet flushers. Then we'll go into the kitchens, how many microwaves, how many buttons, how many lids on garbage cans, then all the common areas, the lobbies, the entrances, the exits. We also need to understand the access restriction depending on the level of cleaning. Level 1, there's no access restriction. We can come and go, no problem. Level 2 and 3, we're going to close the area off. So we're going to need to have that whole area closed off so we don't have people coming in just possibly cross-contaminating it, and also gives us peace of mind that people aren't walking in to our work after it's done or during the process. And people get very concerned when we show up and we all have our PPE on and you have full Tyvek suits. They get very concerned about that. So it's very important that, again, you communicate with the with all of your parties that are involved. And then we also have to understand, how do you want it scheduled? Do you want the schedule to be discreet? Do you want us to come in the back door after midnight, or do you want us to come in during the day in front of everybody so they can see exactly what the effort you're putting in to clean up the possible or confirmed case? All right, we'll move on to what to expect. So during the day, what to expect is when you have the technicians are going to be in full PPE. Expect a large number of crew. Sometimes we've had up to 40, 50 crew members on a site, because essential businesses, they want to be open quickly, but we have to slow them down and say, we need to do a thorough job. So we have to clean and disinfect. So please, we'll bring as many people as we can. They got to be trained, fit tested. They have to understand what's going. Sometimes we're going up on lifts. We need to be harnessed. We need working at heights, your lift ticket. Sometimes we're up on conveyor belt systems. Sometimes we're doing tow motors. We're doing walkie-talkie. So you got to degrease everything first before you can disinfect it. We also have to understand, what is your security policy as far as pictures go? Because we're big fans of before, during, and after pictures. And then we also like to be taking our swab tests, especially for when there's a possible case or a confirmed case. We want to be using the ATP meter, the hygienometer. And you also might want to bring in an environmental company. You might want to have someone like Pinchin or Rockmar Engineer coming in behind us or going in before us, or they're with us while we're doing the work, and they're in full PPE as well. So that's something to keep in mind. Now, as far as the day of service goes, let me just get it there, just 1 second. Yeah, so the day of the service, so on the day of the service, we want to know exactly what level of service are we providing, 1, 2, or 3. We want to confirm the access and the scheduling. Do we need to be discreet? Do we need to be setting up decontamination chambers? You need to have a decontamination chamber for the cleaning of your equipment, for the dirty side of your equipment. So you need to have 2 decontamination chambers. You need to seal the area off. Are we going to need ladders, lifts, harnesses, working heights? So we need to understand all that. So the day of the service, you should already have that all set up, and everything's already decided. And then we wanted to figure out, what is the best way to clean and disinfect this facility? Are we going to use discrete degreasers? Are we using spray bottles? Are we using electrostatic sprayers? Are we using electric sprayers, back sprayers? Are we using high volume disinfectant mobile units? Are we just using microfiber mop heads? Are we using microfiber cloths? What's the best way to clean this facility that's going to give the best results at the end? Do you want to have the HVAC on or off? There's an arm wrestle going on right now with a lot of HVAC companies, and a lot of I guess, even from my perspective, I'm not too clear on should the HVAC be on or off, because we've been getting different messages from our different HVAC companies and ASHRAE and different environmental companies. Some say put the HVAC on, some say take it off. So we are still, in our way of looking at it, in our office here, we have every day running 5 negative air machines. And the 5 negative air machines is because we don't have much airflow in our building here. We can't really open, there's no windows to be open, and the doors are all part of a vestibule system, or they're back in our warehouse. So we can't really open that up. So we're a big fan of having the negative air machines running, but again, follow the scope of work of what the environmentalists suggest, and you'll be just fine. So let's go on to the disinfecting equipment. Oh, actually, sorry, I do have a quick video that we're just going to show real quick. This is just just tells you how things go on the day of. You can just take a quick look at it. Thank you. I really have sound. Good. Oh, we did have sound.
We're showing interest in Facility Plus. My name is David Levy, and I'm the president and owner. Due to the current pandemic, Facility Plus has been helping many essential businesses across Canada by staying open, by cleaning, disinfecting, and decontaminating potential and confirmed cases of COVID-19. Our team follows ECO's emerging and existing pathogen cleaning best practices for environmental professional services, as well as ISSA's and IICRC's best practices for cleaning and decontaminating facilities. We also use the best approved cleaning and disinfecting solutions, as well as approved HEPA vacuum systems, decontamination chambers, negative air machines, and sealing off the areas as required. We also follow all disposal regulations as required for all of our supplies. In potential contamination cases, our team of certified technicians wear full personal protective equipment to ensure our health and safety, as well as our customers. Our team creates a detailed scope of work which includes a thorough cleaning and disinfecting of the facility and ensures no cross-contamination amongst different areas within the facility. In confirmed contamination cases, our certified technicians are in full protective equipment and create a detailed scope of work, as well as we also set up decontamination chambers, negative air machines, and the area we are decontaminating is completely sealed off until completion. Our team has done its best across Canada to keep essential businesses and frontline workers as safe as possible. Please keep us in mind should you require any type of our services 24 hours a day, 7 days a week. Please keep safe. Thank you.
Okay, we're just going to talk a little bit about disinfecting equipment. Just 1 second, sorry.
Just maybe try the right arrow on your keyboard. That should work.
Just IT's doing their thing. Just 1 sec. Thank you. All right. Let's see if we can skip through that. There it is. There's the little arrow there. See the, yeah, right over a bit more. There you go. There's the arrow. You see the arrow right there, the little arrow? Just click on that. There you go. I see what happens. So sorry, folks, 1 minute, technical difficulties.
No worries. Well, Sean, we have the lovely Sean in the background supporting us. Can you tell us a bit more about your Action Central? It looks like Mission Impossible where you sit. It's a fantastic setup.
Just 1 second. Go ahead, Ryan. My IT gentleman is just helping out. Go ahead, Ryan. Do we get it? Do you want to talk about my setup here?
Yeah.
Okay, yeah, sure, no problem. Yeah, so what we're doing here a lot is, yeah, there we go. Just go back 1. There you go.
Thank you, Ron.
This is where we train our technicians across Canada. So we get to show all the different types of equipment, different types of PPE, you know, some of the hard lessons we've learned, the do's and don'ts and the goods that we've learned along the way. So this is kind of our, I guess you could say, our theater to train everybody on how the best practices we're learning, the best practices that we're learning from industry experts. So we just send the message from here out to everybody. That's the whole idea.
Fantastic. Thank you.
Yeah. Yeah. So I'll go on to talk about disinfecting equipment. So disinfecting equipment is exactly disinfecting equipment. You got to remember, it's not, when you're doing disinfecting, you've got to clean first. So a lot of times people think, oh, if I disinfect, that's enough. No, you have to first have a clean area. You can't disinfect over dust. You can't disinfect over grease. So make sure it's disinfected first. And the good thing about the equipment that we've purchased is you can use it for cleaning and disinfecting. The key thing is just make sure you rinse it out thoroughly so you're not cross-contaminating. Not if you're cleaning, you're using a degreaser, make sure when you're finished, you rinse it off. You can see the different types of machines there we have. We have mobile units with two spray guns that can really do a great job in a massive bathroom where you want to get into all the nooks and crannies with disinfectant or cleaners. We have backpacks. We have different kind of, these are called foggers, but we use them as sprayers, and we don't like to be fogging with them. We'll just fill them up with a solution and we'll spray it. And these things can shoot probably anywhere from 15 to 25 feet outwards. So depending how far you want to go. We also have electrostatic sprayers. You can see like Clorox has electrostatic sprayer. This little guy here is this little gun here is kind of cool. We'll use this when we're going into small facilities and we want to do electrostatic spraying. One thing I will mention to you about electrostatic spraying, it is a great process, but you do have to go afterwards and clean up after your electrostatic sprays. Because what happens is, like in our office, we do a thorough cleaning and disinfecting. At nighttime, everything is disinfected and clean. And if they don't go afterwards and use a microfiber cloth and wipe the telephone screens down and wipe all of the plexiglass partitions we have in the cafeteria, in our offices, in the reception area, I usually have them set up in the boardroom, you will come in the next day and you will see a film over everything, and you can barely see the numbers on your telephone screen if you do not wipe everything off. So you've got to be very careful when you're using the electrostatic or any of these high pressure products. Just using a simple a spray bottle and a good cleaner and a good disinfectant, that will do the job. It's an envelope virus that we're trying to kill, and it's on the spectrum of all the viruses. It's one of the easiest viruses to kill. Now, when you get into a sewage backup, that is much more complicated. There's a lot more, many viruses in a sewage backup. That's one of the things, I've been on many sewage backups, and you get on a sewage backup that's 100,000 square feet. You can smell it, you can see it, you can see the stains from it. This virus, you cannot smell, you cannot see. So when you're cleaning and disinfecting, you have to have the best equipment, the best supplies. And the major thing is to go slow, do a thorough cleaning. Depending on the dwell time of the disinfectant you're using, respect the dwell time. Make sure you're not cross-contaminating your cloths. Make sure you're changing the water out. Make sure you're going nice and slow. Don't be using any brooms. Don't want to be creating a lot of dust. We're big fans of HEPA vacuums that we're using. Whenever we go to leave a facility, we double bag the garbage, we seal it up with duct tape around the top. We're always making sure that we're doing that. It's the same with our equipment. Whatever equipment we use on a facility, before we leave that facility, we give it a very good thorough cleaning and disinfecting. And then we make sure that if we can, we'll put these in little bags, these little machines like that. Some of the other ones are hard to put in the bags, but we will clean it down, 3 or 4 times with disinfectant. If you cannot respect the dwell time on the product, just go over that area 3 or 4 times and you will be fine. I've done lots of testing with this machine, and when you've done it 3 or 4 times, even a couple times, you'll see a huge difference. Even once, it's fine. Once you've done a thorough cleaning, a good disinfecting, this machine it tells you exactly what's happening. It's for the food industry, so it's a very good product. That this little machine right there. Let's talk about HEPA air machines, the HEPA air scrubbers that I was talking about. So you can see here, again, HEPA air scrubbers come in all different shapes and sizes. And I'm a big fan of them because they create airflow. If you listen to people all the time, go outside, go outside. You're not going to get sick if you're outside. Well, that's not necessarily true, but the airflow outside makes a huge difference when you have airflow going. So you want to have as much airflow as possible, especially in my building. We have no airflow. We have 5 of these machines going all the time because we want to create our own airflow. We want to clean the air. The whole idea about when you're using a negative air machine is you want to be figuring out what size of the room I'm trying to clean the air in. So am I dealing with, when you look at a room, you want to talk about cubic feet. So you want to go length times width times height. And you say, I'm trying to clean the air in a room that's this many square feet. So you also want to make sure you're getting a minimum 6 air exchanges per hour. So what that means is if you have a room that, I'll give an example, that blue machine on the couch there, that's called a HEPA 500. So the HEPA 500 does 500 cubic feet per minute. That means in a room that's 5,000 cubic feet, you'll have 6 air exchanges per hour. That's how that works. So my little room here that I'm in a little boardroom here that's 25 feet long, 9 feet high, and it's about 15 feet wide. So that's about 3,375 cubic feet. That means this little HEPA air filter, when it's on the 500, it will give me at least 9 air exchanges per hour, which is awesome. That's enough for me. I'm happy with that, and it works just fine. The one thing you got to keep in mind when you do have negative air machines is you have to make sure that they're DOP tested. So once in a while, you call up someone like Safety Express, Hazmasters, they'll come by your office and they'll do what is called DOP testing. And then they'll give you a list of all your equipment. They'll tell you the date they had it DOP tested. The reason you want to have it DOP tested is you want to make sure whatever is going into that machine is still coming out 99.97 clean. That's what you're looking for. And they will tell you that what they do is they put a little bit of smoke down the machine. And then when the machine comes out the other end, it will tell you exactly how clean that air is. And it will tell you, okay, your HEPA filter needs to be changed. And last week, I learned one of my vacuums, I couldn't even see it. It had a hairline crack in it. One of our HEPA filter vacuums had a hairline crack, and it didn't pass because he told me, you have a hairline crack in your HEPA vacuum here, that you have to go and get this replaced. It's not going to work. So that's a good thing about having these machines DOP tested. It will tell you how effective it's being. The other thing you got to be careful, if you're planning on using a negative air machine in your home, keep it away from open flames, keep it away from your fireplace, keep it away from your furnace. As the draw is that much, it will suck in the fumes from that, and it's not good. You want to make sure that whoever installs these for you understands the power of a negative air machine. You do not want to have gases going through your home because that's powerful. It will do that. It will pull that much air from your facility or from your home. All right, let's move on to disinfectants. So Health Canada approved
Sorry,
disinfectants.
David. I'm just going to let you know we are approaching the 12.
Oh, okay.
Just
I
giving
can
you a
speed
heads up. There's
Yep.
lots of great content here. I don't want to rush you, but just giving
Yep.
it.
Okay, I will speed real fast. Okay, so we're big fans of using, especially Decon 30. This is great for using on porous materials like furniture, carpets, wood, fabric panels. So this is good for anything porous. This one right here. The Benefact, you got to clean first with it. You have to use a cleaner. This Clorox machine, you have to use a cleaner first. So just understand when you have a Health Canada approved disinfectant, it has to have a DIN number. It has to keep in mind that not all disinfectants are cleaners. They may have a mild cleaner in it, but you have to be careful that it makes sure it has an SDS sheet that comes with it, and you understand the capabilities and what's the dwell time on that disinfectant. And then I'll just go quickly onto the Hygiena machine I was showing people before there. Is it there? Okay. So just 1 second. There we go. So this Hygiena machine is just awesome. This machine I find is great for, like I was saying, it's used in the food industry. It gives you within 10 seconds, it will tell you, the swab will tell you how clean that surface is. So you can just look there and say, am I making a difference? Which is good. It's also good to show customers that we're making a difference. It verifies for your common areas, your meeting rooms. You can use it in all your high touch areas. So it's a great tool to have. Any company in this kind of business should have this service available to you if you want to use it. And then we'll just go on to the final steps. So the final steps, we just want to make sure that whenever the contractor is leaving your facility, you got to be careful for cross-contamination, proper removal of the PPE. Is the facility ready for occupancy? We want to make sure that some of these disinfectants can smell. So, we use ones that have no scent, but sometimes when the marketplace is overwhelmed, there's not enough product, you sometimes have to go to a product that has a bit of a smell to it. If that does happen, we can install a negative air machine with a charcoal filter. I'm sure your supplier should be able to do that for you as well, if there is a smell there. And you want to make sure that all the information is shared with the customer, the ATP readings, the before and after pictures, any documentation is all set there. I'm just going to go quickly into the best practice of reopening of your facility. Obviously, follow safe practicing. I'm going to show you some of the things we do that we have. Is when you come in, you have the option at our office. You can take this with you and you can put it on your desk. It just kind of keeps your area nice and clean. We also we've installed stickers throughout the facility. We've actually made it 7 feet apart, and I'll tell you that in a minute. And then these arrows, we have those. We also are putting these up, please keep my family safe, please stay 6 feet apart. Because what I think every business should have, and because you were alluding earlier, Sarah was saying about we're all getting fatigued. You really need a safe distancing sheriff, and you need a mask sheriff, because it's so easy for people to forget to put it on. You want to make sure there's continuous airflow. You want to collaborate with your building management. So how are we opening up? How are we going to be going into the common areas, the elevators? How's that going to work? Right now, we're working on what's called a GBAC star accreditation. That's through the ISSA. It's almost like having your building IS 9002 certified for cleaning infection control. So people come here, there'll be a sticker on our door. They'll know that, hey, these guys take this very seriously. So thank you very much. Sorry I went over time. And I hope everybody got a couple of nuggets out of the presentation, and thank you very much. Have a nice day.
That was fantastic. Thank you so much, David. We are going to get into our question and answer period, but I thought it would be really nice if we can show that Tim Hortons video. I think Sean will take over control and he'll be able to pull it up. We just had to sort out a small little tech issue on our end, so apologies for that. But while we're waiting for Sean to pull it up, question for you, David, is how do you find time in the midst of a pandemic to continue to partner and give back to the community?
I think it's part of it, of having any, if you have any bit of little success in anything in life, you have to give back. And we've been fortunate enough, my team and I here, to enjoy a little bit of success, before the pandemic. And we've been able to help out a lot of customers through this pandemic. And we're going to be going in for a tougher time over the next 6 months. And we will continue to do everything we can to help the community at large, help people any way we can, because we're all in this together. And this pandemic, this disease, this virus, anybody can catch it. None of us are susceptible to it. So if we're all in this together, we really got to help each other out. So it's a pleasure to be able to help as many people as we can and give back as much as we can.
Thank you. It really means a lot to us, especially. So we'll start off just, Sean, if you wouldn't mind pulling up that Tim Hortons video, and then we can get back into the Q&A.
Welcome to Tim Hortons. How you doing? What? That's crazy. Can I take your order?
Small coffee, too, please.
How does it feel to know you're such an essential service right now?
We're very proud to know that we're keeping businesses open, which helps the greater good.
Well, it's been a challenge, but we're getting through it.
Well, we wanted to pop in today and show you a little bit of appreciation.
Thank you. Thank you so much.
Morning.
Morning.
Close your eyes. Feeling better now?
Much better. Thank you.
How awesome. That's fantastic. Thank you so much for sharing that with us. So again, we are in the Q&A section. So hope you've been paying attention. We have some fantastic prizes from Facility Plus to offer to some of these today. So hopefully you have absorbed everything. I know it was a lot, but please use the chat function to ask any questions as well that you have. I see I've got one already. Anything that's been burning throughout this presentation, and we'll answer those as well through David. For any of the Facility Plus prizes, only responses to the entire chat function, so no direct DMs to Sarah Claire, only the messages that you send to the entire group. It'll be the first person who answers will be the winner. So put that out there. Those are the rules, and let's kick it off, David. So first off, I want to ask you, how do you ensure that you're up to date with industry best practices?
Yeah, so that's a great question. So we've partnered with companies like Pynchon, Rockmeyer Engineering, ISSA, you know, the IICRC, the World Health Organization. A lot of our suppliers are putting on great videos, a webinar. Pynchon had a certification course. ISSA had a course called Germ Warrior, which our whole company took. And Pynchon, we took their video and we learned from their video. There's so much information that you can be I know my family's watching different shows, The Bachelor or whatever they're watching on TV. I'm sitting there reading and constantly educating myself as much as possible on what's the best practices to be using, because it is changing and you got to be up with all the changes constantly. So you have to have the appetite to continue learning every day, because every day I learn something new about this virus, how to beat it, what's the best practices, the best chemicals, the best equipment. So you want to be in front of it, the best PPE. You want to make sure you're always constantly educating yourself.
Certainly, thank you for that. Alrighty, this is a prize question, folks. Alrighty, so the prize is, it is a box of level 3 surgical masks. There are 50 in a box. So let's see what our team has to offer here. The question is it, remember, get your chat function ready, respond all to the group. Is it best practice to change your surgical mask when it becomes damp? Bruce Jones, the answer is indicated yes. David, can you tell me if that is correct?
It is correct, yeah. You want to definitely, you don't want to have a wet mask.
Excellent.
Or the damp mask for that matter. They recommend, real quick, they recommend every 4 hours to change your mask. But if you're in a position where you're sweating and perspiring, I would be changing your mask even more than 4 hours. As soon as it's damp, change it, because it's collecting a lot of dirt and dust. It's not good.
Excellent. Bruce Jones, we will be in touch with you. Thank you, everyone. Great to see the chat function being used. This is fantastic. I'm going to go into another prize question. This one is, the prize is, it's one personal cleaning and disinfecting kit for your car, home or office. This includes a cool spray bottle, 1 bottle of Health Canada approved disinfectant, 1 box of commercial cleaning towels, and 1 box of commercial grade gloves, small to XXL, and 1 black light to see how well you cleaned. So that's pretty awesome. Get ready. Here comes your question. When getting tested for COVID-19, share 1 lesson learned today.
Oh, I didn't really talk about that. Sorry.
Okay, let's just see what the team has to say.
Yeah, yes, sorry.
There has to be something that we've picked up on today.
I didn't really touch on it, to be honest with you. There was so much information I had to, sorry.
What about self-isolate? Or book your appointment, not too early, any of those? Stay 7 feet apart.
That's good. Yeah, that's good.
Is 7 feet apart the answer?
That could, yeah, because when you go for your testing, you're lined up down the street. So stay 7 feet. They say 6, but stay as far apart as possible. And really, to me, you should be wearing a mask and a visor and gloves. And I prefer, you know, respectfully, nothing against the hospitals, but I prefer to go through the drive-through. Don't go into a hospital unless you're in full PPE. It's just too much going on there.
Definitely. So the winner of that is Tracy Legault. We'll be in touch with you, Tracy. Congratulations. Alrighty. Here's another question for you, David. This is not a prize one. We are hearing a lot of attention being focused on air filters, and you talked a lot about that today. But how are you responding, giving concerns regarding supply shortages? We're hearing about that. We're hearing about the potential for, you know, increases in cost. Unfortunately, some vendors have been responding to the market accordingly. How have you been able to manage that? Like, do you have any concerns? How is Facility Plus been able to approach that?
Yeah, we're obviously very concerned because, again, Canada, it's a small marketplace compared to our friends south of us and some of the other marketplaces. So it's going to be service everybody first and sell to them first, and then trying to get it over the border is going to be difficult. Like we were looking at doing a purchase of 200 air scrubbers coming in from California where the manufacturer is. And what I said to them was, well, prove to me first you can get 1 or 2 over the border, and then I will go ahead and we'll place an order for a couple of hundred, but we're not going to be investing that kind of money until we know for sure we can get over the border. We don't want it. We've had stuff that we've ordered back in April, May. It still hasn't crossed the border. So we do not want to have a truckload of our air scrubbers and the HEPA filters and the pre-filters all sitting at the border that we cannot clear because they won't let it over. So it's one of the things that we're diligently working on it every day to increase our supply. And we're working our best to try and have an inventory of air scrubbers that we can either sell or rent to our customers and service for them.
Excellent, thank you. And on the vein of filters and HVAC and all that fun stuff, we actually have a question from Claire McGregor.
Yep.
Do you feel that there's a value in installing UV in HVAC?
So I'm not an expert in HVAC. I would probably pass it over to, like, it's funny enough, I was talking to my HVAC contractor for my building here yesterday, and what he's coming to do for us is he's going to be increasing our filters on the roof to hospital grade filters. And he was also mentioning to me for $1,500 to $1,800, we have three rooftop units. He can put the UV lighting on there. So I said to him, just prove it to me. There's science behind it that is going to work. That's all I want to make sure, that there's some science behind this and it's been proven that is going to work. If he proves to me there's science behind it and it works, we'll definitely make the investment to put them on our rooftop. So I just don't have enough experience to comment on that, but I would talk to either ASHRAE or a reputable HVAC company that can comment on that for you.
Certainly, yeah. There's at the end of the day, as long as it's public health endorsed properly and the science is behind it, it's a very good point. Can get kind of caught up in all of the new products that we're all seeing flooding the market, right? So that's really good feedback. Thank you. We have another prize question coming up, folks. So this prize is a safety visor, 1 half-face respirator with 2 P100 cartridges, 1 pair of safety goggles or glasses, 1 Tyac suit, will fit you out for that one, large to double XL, 1 pair of booties and a box of gloves. Alrighty, so get ready, get those fingers ready. When selecting a qualified service provider, name some qualities that you need to look for. Okay, the first answer I see is ISSA CERT. Let me just look. I'm just validating against what David has sent me. So I'm gonna go with experience reputation. So that was the first person, Graciano Govia's reputation. You sent that to us, so thank you so much. We'll be in touch with you about a prize. And the lovely Maria, I hope you're noting these names for me. I'm going to continue down the prize questions since we're getting so close to the end of the hour. I want to make sure we got through these because these are fantastic prizes. Super jealous. The next prize is 6 containers of Lysol wipes. These are thick and strong, 80 wipes per container. As everyone here knows, they are quite challenging to obtain these days. Look at that. The lovely David has it to show for us. Thank you, David. Look at that smile. All right, here's your question. Get the fingers ready. What is dwell time? DWELL. I'm looking for a bit more than that.
Yeah.
A little bit more than that, Buwan.
Bruce Jones.
Bruce Jones. So that's the amount of time that you have to leave a disinfectant on a surface to be infected.
Yeah.
Thank you so much. Look at this active group. How fantastic. Alrighty. Moving on to our next question. The prize is 2 boxes of N95 filters to create your own masks. So get ready. Here's the question. Name 3 different types of disinfecting applications. Go.
Mm-hmm.
Got mist spraying.
And fogging. Yeah.
Will you accept that answer?
Yeah, it's close enough. Yeah. Yeah. That one, yeah, unfortunately.
3 though?
Melissa's on our team, so unfortunately, sorry, Mel.
We need 3 answers though, right? For it to be the winner?
The first one had it. They said mist, fogging, or spray.
Mist spray fog. Oh, my apologies. So Vince Alexander,
Yeah.
you are the happy recipient
Yeah.
of the prize. Fantastic. Thank you. Thank you, Melissa, for the LOL. Awesome. Okay, so we have a 6th and final grand prize. And this one would be more for our IFMA members who have been paying attention to our membership numbers. As you know, IFMA Toronto and South Central Ontario, we are a growing chapter. We are one of the largest in the world. So we're looking to award someone this very cool prize. It's 1 complete PPE package from head to toe. This includes 1 Tayac suit, a pair of booties, a pair of gloves, a box of them, sorry, of gloves, a full face respirator, which includes a fit testing, which will be arranged by the Facility Plus team in the next few weeks, and we'll coordinate that, and a package of N95 filters for the exhale valve, and a roll of duct tape for sealing the ankles and wrists. So, here's the question. How many members at current state does IFMA, Toronto, and South Central Ontario have? And I will take a winner within the first winner within 10. Close, Buon, you're close. Oh, Kathy, you're warmer. Oh, that's my cat. Oh. Melissa, you're getting colder, but I love your optimism. Alvin, you're close. All right, everyone's gonna start jumbling all sorts of numbers. So I'm gonna give this to the first person who got it in the same thousands. Simon, thank you so much for visiting. That would go to Kathy Ayers. So thank you so much. So we're gonna wrap it there, David, unless you had any final words before I close.
No, I just thank you very much for having me today, and my team. Thanks for my team, and thanks for all of our partners across Canada and all of our employees across Canada doing a great job. And just of everybody, we're going to be, you know, it's winter time. It's going to be winter time soon, and we just got to work together as a team and get through the next 6 to 8 months. And just try our best to look after our mental health and just try to cope with this extra stress we're all under. And hopefully we'll be back playing golf, if not 2021, 2022. Our team really missed not going to the golf tournament this year, and the gala we really missed. We have that, so we just want to be able to enjoy all that stuff again with our IFMA community.
Oh yeah, we can't wait. Trust me, we're dying to get back out there again and host events in person, but we really appreciate everyone tuning in today. Thank you to David Levy and the entire Facility Plus team for pulling this together. This has been a great presentation, active discussion, and we could have gone on for much longer. There's just so much information out there. We do need continued support like this from the FM community in order to continue to provide excellent programming during these unusual times. We'll post today's recording to our YouTube channel. Thank you again for joining and participating. If you have any ideas that you'd like to share in terms of content for a future webinar, please reach out to us through our social media outlets. We'd love to hear from you. Lastly, IFMA Toronto and South Central Ontario would like to thank all of you that are working on the front lines as essential workers. We couldn't get through this time without you. Take care, stay healthy, and keep in touch.
Thank you.
Bye.